So one of the biggest challenges with mental health is not having a vocabulary to actually talk about it. And when I was a kid and people would say like, hey, you need to talk about your mental health, you need to talk about your feelings, like I didn't actually know what that meant. I didn't grow up in a home where people talked about their emotions or talked about their feelings.
Did you put these awards of mine in the closet? What if I did? Well, why would you do a thing like that? Because I felt like it, that's why. What kind of a dumb reason is that?
And so that kind of mental health vocabulary is just a really critical part. So for example, if you think about physical health, all of you know the difference between having a sprained ankle or having a broken leg. You know the difference between having diabetes or having cancer. And we really need to have similar categories for mental health.
I feel like we should break these into categories.
The kind of 5 categories of mental health that I use are everyday challenges, which are things all of you can experience. Stress, lack of sleep, poor body image, low self-esteem, things like that. Next to that would be environmental factors.
So, this all seems horrible.
So for environmental factors, you have to think about the home you grew up in, the school you go to, the way you're raised, and how that environment affects your mental health. Next to that would be significant events. And significant events are experiences with loss, change, or rejection that impact a person's life. So a breakup, a parent's divorce, getting accepted or rejected from a school, going through something that could happen multiple times in a year, but actually affects your mental health. And then next to that would be mental health disorders. And mental health disorders are diagnosable mental health disorders like anxiety disorders, clinical depression, bipolar disorder, things that are diagnosed by a mental health professional. And then next to that would be developmental disabilities. And developmental disabilities are things like autism spectrum disorder, intellectual disabilities, ADHD. The reason we need those categories to be separate is because when someone has everyday stress, it's not the same thing as having anxiety disorder. Going through a breakup is not the same thing as having clinical depression. And so when you go through something, what can help you is to look at, okay, what category is this in? And then how do I need to address it? How do I need to deal with it? Those categories can be a guide and a map for your own mental health and how you talk about it.